life is complex.
So is our mental health. It cannot be understood by diagnosis alone.
Our philosophy is treat the person, not the mental illness.
Hello, everyone, and welcome to another episode of Humanizing Mental Health. I'm Trent Nakers.
And I'm Jeremy Alcorn. Well, welcome back.
Yeah.
We've had Dr. Earnestine Whitman on our show before, and we're very grateful for the opportunity to have you back. There's a rich and full conversation, I believe, that we were having. We didn't really have time to cover some very important points.
Yeah. And like you and I do a lot of times when we're doing therapy, it's not that we end a conversation, but we pause it. And this time we're going to be able to pick up kind of where we left off. Is that right, Jim?
Mm-hmm. Yeah. So off camera, we had a little bit of a conversation about some key points that you felt were really important that we didn't have a chance to touch on. Now, anchoring back to our previous episode, if anyone has not viewed or listened to that yet, we recommend they go back and listen to the episode at Counter Melodies. This will be part 2 of that. Yes, perfect.
Thank you, Ernestine.
Yeah, awesome. And we want to link into some of those key spots that we missed. Ernestine, where would you like to start?
Well, I thought I could start with stepping back and, just saying that when I look back on my life, as you do when you reach a certain age, but also when you write a memoir, it was the decade of my 20s where all the really awful stuff happened. Now, I was vulnerable to that stuff because I have this deep longing for male approval, which went back to my father. But in terms of the specific traumas, those began in my 20s because I was 20 when I got into the Atlanta Symphony. And if you heard the first podcast or you're going to listen to it, I describe how I was very attached to my teacher who had been my mentor, but he turned against me and tried to get me fired. So when that happened, my self-esteem plummeted. And at that point, I knew that I needed to see a therapist. The problem was I was 20. I didn't have a lot of money, and the psychiatrists were pretty expensive. And this was in the 70s. So there really were few alternatives. There were not many social workers or counselors with psychology degrees. So it was pretty much psychiatry or you're sort of on your own. So I found out about this man whom I call Dr. Norton, who was training to be a psychoanalyst. And because he was training, that meant that I didn't have to pay much. In fact, I think it was $3 per session. Even in the 70s, that was pretty low. And I saw him 4 times a week, as you would in psychoanalysis. So that was a good deal financially. And at first, it really helped to talk to someone, even though he didn't really understand Lord's dilemma, but he certainly understood the family of origin trauma or susceptibility to male authority figures. And he understood maybe why I'd be subject to this man, Warren's verbal attacks. What he didn't understand was that this man had been my father figure. So he understood a little bit, but he was intent on his own purposes, which was to probe the psychoanalytic aspect of the patient.
So there's just something that I felt was a useful reflection as you talk about that. Like a couple. One is that this person had some of their own needs that needed to be met in terms of their training. And so that became more about them than about you. And the other thing is, if they understood the male-female power dynamic, they ought to have treaded very lightly with that.
Yeah. And, and as I hear that too, Jeremy, if I can just jump in there, like I almost wonder, granted this was back in the 70s, but I would almost say because of what you experienced, I would really question whether or not the theoretical orientation was in proper alignment with what you were facing. Because if he wants to dive into that, I would almost say, well, as we talk about a lot today, like where it's being trauma informed, I would say definitely using that theoretical modality wouldn't have been trauma informed because of how it's approaching everything and wanting to, for like the classic psychoanalytic, almost take on that role in some ways or reflect on that level.
Yeah.
Is that fair?
Yes. I mean, of course, one of the tools of at least his approach was silence. That is, patient is on a couch, not facing him, and, he doesn't say much. But that does allow the patient to sort of transfer their emotions onto him if they are prone to do that, which I definitely was. The problem with this analyst was, well, actually, I think now might be a good time to review.
For sure, yeah.
So this comes from a session when I enter the session very upset by what Warren, the principal flutist, had just done in the rehearsal, which was about an hour before the session started. And I try to explain it to this man. So I say, I don't know what else I can do. This is talking about how I can respond to the burst flutist. It would help if he would, instead of scowling, tell me you're a little sharp or a little flat. But when all he does is scowl and grab his knee, it doesn't help. So I have to explain the grab the knee thing. In a professional orchestra, the second flute is sitting to the right of the first flute, and we are only about 2 feet apart. So when this man got agitated, he would frown, but he would also grab his right knee, which was really in my peripheral vision very clearly. And he would clench and unclench like he was just beside himself because I was playing so poorly. When he keeps grabbing his knee, it's like my playing is driving him nuts. How do you know his gesture has anything to do with you, Dr. Norton? Well, I'm sitting next to him, and he always does it right after I play an important part. Could you be mistaken about why he does that? I don't think so. The timing can't be coincidental. He just isn't happy with my playing, and neither am I. And then there's silence, and then I go on. He used to say I had a great ear, that my intonation was excellent. When was that? Dr. Norton asked. Finally, a reaction. That was when I was his student in high school. I say, you said your father was very critical of you. Wasn't that also in high school? Yes, but I'm talking about what happened today in rehearsal, just hours ago. More silence. You think I'm making this up, but I swear it's real, and it's happening more and more. Even if it is real, you might be making it more significant than it really is. As usual, I left the session annoyed and confused, doubting my perception of things. I knew Dr. Norton had a valid point. Warren's behavior upset me more because of the distant, at best times, relationship with my father. But Dr. Norton did not understand that for years when it came to emotional support, Warren was my father. In addition to not recognizing my dependence on Warren's approval, Dr. Norton didn't understand the tense atmosphere of professional orchestra rehearsals. Non-musicians assume that rehearsals are fun, but each rehearsal is like a 3-hour audition, with conductor and players constantly assessing each other's performance. So I was under a lot of pressure, and this was after the pretty well-known conductor Robert Shaw took over and did fire a lot of people in the orchestra. So, yes, my analyst had his agenda. The principal flute had his insecurities too. But I, being a former student of his and he being my idol, I had no inkling that he felt any pressure. I just, I thought of him as invulnerable. And it just wasn't part of my awareness. I was aware of how he treated me, but I still idolized him, so I couldn't imagine that a new conductor would threaten him. But it was the repeated sort of disconnect between what the analyst was trying to get me to see and what I needed at that point, which is what Trent was saying before. And it just left me doubting my perception of things, which, of course, the principal flute was trying to get me to do that very thing. It was sort of gaslighting from both sides, or two different.
I'm really curious about your reflection.
Yeah, because I'm sure you can see my mouth moving. Because with that, like I think, like really you wanted a sense of validation. Really, our job as therapists initially is to step into the world of the client and understand their perspective. And you have to be very, very careful, or at least I try to initially, whenever you're calling into question or you're bringing things into light, because it's about attunement, and where we've talked about that before, where it's about, the client takes the lead. And if you're going to gently guide, you have to make sure there's trust and there's a relationship there. Because as we've talked about several times on the show, that the relationship is the fundamental core of therapy. That is what really is the change process. That's the lubricant that helps people open up and expand. And it makes me think of like I'm trying to think now, the movie with J.K. Simmons, where it was about jazz drummers, where he was almost rushing. He was moving it too fast, where you needed him to slow down to meet you where you were at.
Yeah, I'd also say pacing was wrong. That's for sure. And also a reason why psychoanalysis is just not used a lot. Because fundamentally, we know that there needs to be a sense of connectivity between people. You're sitting there, they can't see you. The person experiencing the psychoanalysis in the spot of what do they think about me? It really actually comes off, everything that you said comes off as super judgmental, judging your perceptions, rather than collecting someone into a therapeutic relationship. One of the other interesting points there for me is you still were left alone in your experience. Therapy is supposed to be about the therapist being with the person in their experience.
Yes, I often felt very alone because I didn't feel like he was understanding me.
Yeah, which is the core fundamental first step.
Right.
That there's a safe place, and that even if the therapist doesn't necessarily even agree with the conclusions that you're coming to, that there's no judgment about them, that they don't come across as you're wrong, which really sounds like kind of how that was experienced.
Well, of course, writing the memoir decades after it happened, I can't be sure that I'm quoting him precisely, but I know the gist of what transpired in those sessions. So even though the dialogue may not be word for word, the sense of what he was trying to get me to talk about is certainly accurate. And at one point after this, there was a piece on a program that featured two flutes as soloists. So I had to stand at the front of the stage with this man who was tormenting me. And the conductor would tell me to play louder, and this flutist would tell me to play softer. And it was an important concert because we were featured soloists. And when I asked Dr. Norton for just a little bit of something that might calm me down for the first concert, and of course he wouldn't, and then he kind of questioned me. He said, "Well, why do you need it now?" And I said, "Well, I've never been a featured soloist before, and every rehearsal just underscores that I'm being caught between opposite requests: play louder, play softer." And he said, "Well, what happens when you get nervous?" And I explained that my hands trembled and my mouth dried up. And when your mouth is really dry, if you're a woodwind player, that is very bad news. It's really hard to get the sound you want if your mouth is so dry. And so I explained it to him, but of course he wouldn't give me anything. And
when you say give you anything, are you talking about some sort of medicine that you could have used, or are you talking about other therapeutic guidance?
I'm sorry, I did not catch all of that.
Yeah, I was just wondering, when you say he wouldn't give you anything, were you referring to medicine that he was unwilling to prescribe? Yeah.
Right. I think at that time it was already beta blockers. And whatever he would give me, it would be a very low dose, and maybe it would be partly, the word is escaping me right now.
Yeah.
But I felt like it would be just enough that I could calm down, and just the placebo would make me less apprehensive about the guns.
Yeah.
But as I understood it, maybe, I don't know, if you can tell me if this is true. In psychoanalysis, they very rarely use any drugs.
Yeah. Yeah. They don't see it as interfering with the process, for sure. If I could join with you for a moment, it's interesting you say this, because my son, as a teen, was a musician in a band, had a lot of stage fright, and we were talking with a pediatrician. I think my son was 15 or 16 at the time. Yeah, and the pediatrician said, "Oh, just take one pill of propranolol before you go on stage. That's it. It'll just reduce your blood pressure a little bit, change the signals in your heart a little bit, and you'll feel okay." And yeah, totally works.
That's the exact drug that I think, well, I know later is commonly used by professional orchestra musicians, especially before a very important concert or an audition. So at one point, a person who used to be a flutist but became a counselor and lived in Denver, she said, "Oh, 2/3 of the Denver Symphony musicians take Inderal."
Yeah, no, yeah. And
It's propranolol. It's
Yeah.
right?
But it might be known by another name. That's just the name I know it by.
Okay.
Yeah. I again too, this is different theoretical orientation, but it all, like how I approach therapy predominantly is I want to stabilize people first, and then you go into that. So I would almost say it's like, the first appointment with me would have been like, what skills do you need in order to function in that environment first? But that's just how I approach therapy. I think that's pretty similar to yourself too, in some degree, isn't it, Jeremy?
Yeah, the starting point is stabilization, rather than digging with sharp claws, as it were, into someone's core concerns. At least that's how I would see it. I would see it as someone digging into the sharp claws. But
Yeah.
I'm also interested in this particular therapy that you had with this analyst. How long did it last?
Well, I started it in fall of my third year with the symphony, and the nadir was Christmas of that year. So I was seeing him 4 times a week, and I had seen him 4 times a week for almost 4 months when I had the suicide attempt. I saw him for the rest of that year, but at the end of the year, I decided, even though it wasn't very expensive, it wasn't worth the amount of time that it took. I think if we were really accomplishing things, I might have stuck with it. But it was, even though a musician's schedule is pretty flexible compared to an office worker, it was still sort of a struggle to get there 4 times a week. Although it happened to be across Peachtree Street from Symphony Hall where the rehearsals were. So it was very convenient. But the short answer is a year. I stuck with it a year.
Are you open to talking about what brought you to that point where you did attempt suicide, and talking kind of through how you got through that?
Yep.
And if not, that's okay.
Last time I read, excuse me, even now, chucks me up a bit. I read a passage of the frame of mind I was in, and it had a lot to do with isolation and alienation. And I think, at Christmas, we're all perhaps more vulnerable to those kinds of feelings. But it was at a point where I felt particularly estranged from this analyst because Warren, my core mentor, was stepping up his attacks, the frequency of his insults and, trying to undermine me. And at the same time, the analyst seemed more distant. So it was sort of a crisis of feeling very, very alone. And the Christmas concert with all the couples in the audience and people in the choir who were friendly colleagues with each other, I just felt very, very isolated. And what I did was I slit my wrists. And fortunately, I had this moment of what if? And I thought, what if I maim myself, but it doesn't work? What if I do just enough damage that, this and that, and then all the what ifs, and then Warren will have gotten not that he wanted me dead, but Warren would have won. So there was a little bit of pride, obviously self-preservation, but at that crucial point, I thought, I don't want Warren to win. And when I went to the first rehearsal afterward, oh no, it wasn't a rehearsal, it was a convoy.
Did
we
you
had your long sleeves, so it sort of camouflaged the bandage. And the only person who noticed it was Warren. And his line, and I know these words are correct. So you botched that too.
Oh.
Yeah, that's pretty thoughtful.
Oh, wow.
And then he, like it was a joke, but it was. And I did not, at first I didn't tell Dr. Norton about it, but at the end of a session, I just said, well, I got really depressed Friday night and I slit my wrists. And he said nothing. And that was it. We didn't explore it. He didn't say that must have been really hard for you. You know, he was, as usual, silent. And at that point, that was really hard to take because I unconsciously had counted on him for some comfort. And at the time, I was estranged. I had not yet made the friends in the orchestra that I came to be very close to. So, you know, it was, I think at that point, maybe even an analyst might have stepped out of that silent role and said something.
Yeah, been a little bit more direct. Yeah.
Yeah.
Okay.
Well, and you know, like the fact that you brought that up at the end of the session, isn't uncommon for a lot of clients to bring up big things like that. There, like, I believe it's called door handle syndrome or something of that nature. Because for you, like I'm like, just as I could hear you talk, it's like my relationship or your relationship with that gentleman was tenuous to begin with, and you're almost like having to bring yourself up to say this, especially with how Warren reacted. And then at that moment, you know, if it were today, that's when we would go, okay, whoa, wait, let's pause and let's go through something like a safety plan where it's like, let's keep you safe right now, which that's something that is relatively new. Before they used to do contracts for suicide, which we found now that are not possible. But I can only imagine that took the relationship and that was tenuous to begin with and just, you know, broke it to an even greater degree.
Was it soon after that you stopped attending?
I'm sorry. Again,
Was it soon after that you stopped attending? Then you stopped there with him?
No, I stopped seeing him at the end of the year.
So still a while.
I still, you know, it took me a few months to decide to quit because at least he was there to talk.
Yeah, better than nothing. Sure. I also was wondering, did you get medical attention when this happened? Did you go to the hospital?
What I did was, you know, it was after I had cut the left one that I got this second, the sense that I wanted to save my life. And I just wrapped my wrist in a towel. And in those days, the cars were all stick shifts. So when you have one hand to drive, it's kind of tricky. But I did drive myself to an ER, and I saw an exhausted intern at 3 a.m. And he said, "Is there anyone you can call?" And I said, "No." And that was it. I had stitches, but it medically was not serious. Although I still have a scar. It was just, I never got any follow-up to how acutely isolated I felt and the depth of my despair. I felt like I just had to put it aside, you know, just carry on and ignore it.
So they basically patched you up. They patched you up and sent you home.
I am sorry. I'm having trouble hearing you, Jeremy.
That's all good. I said they patched you up and sent you home.
Oh, yeah, absolutely. Exactly. There's no one you can call. Okay, goodbye.
And, you know, I would almost wonder there too, because during that time, I don't know if either of you would know that, but I would imagine today, if somebody were to come in with something like that, I believe medical professionals would do just sort of a check for suicidality just based on, you know, those types of injuries.
Yeah, they would do a risk assessment and then determine even if they're going to let you go home that night.
Right. But the way I recovered, and we said a little bit of this the last time, was that friends in the orchestra, I developed friendships in the orchestra because the people sitting around me could see what the first flute was doing to me, and they took me aside and said, look, the problem isn't you, it's Warren. And their support of me at that moment was what I had instead of therapy. But it really addressed that direct gaslighting of, oh my gosh, I can't even tell if I'm playing well because he says I'm not. And these musicians who were also young, as I was, said, no, the better you play, the worse he treats you. And, just ignore him, which is very hard to do. But I got better at it.
So they provided you the validation and normalization that we as therapists strive for today.
Right. Well, you're never in rehearsal hours a day with your patients. So
True.
I saw a lot of these people.
Yeah, very true. And I really appreciate you sharing this very vulnerable experience in your life. Hopefully, one of the messages that people can take away is that if you're finding that there isn't a good fit within the therapy relationship, that there's such a massive sense of power there. And it's really important to know that either you talk with the person directly about this isn't meeting my needs, which is sometimes very hard, or you decide to vote with your feet and just not come back to connect with someone else. Trent, do you want to speak a little bit to Scott Miller and kind of how he approached this with people?
Yeah. So thanks for bringing up Scott Miller. Yeah. So so there was a psychotherapist, well, actually he's a researcher now, that really looks at how can we improve and really understand the therapeutic relationship. So normally there's two scales that Scott Miller's found, the outcome rating scale, which basically looks at a lot of the main factors in your life, like how you're getting along with your family, your friends, work and school and overall. And that's usually administered before a session or at the very beginning of a session, just to see where you're at. And then at the very end, we typically do what's called a session rating scale. And that'll look at things like topic, individual relationship, approach, and like just general sense of the session itself. And it's usually on a scale, usually from like 1 to 10. And what we try to find is, especially with the session rating scale, where as therapists, we try to aim to get 8 and above. And if it's like 7 and lower, that's usually where we'll check in, because that could indicate some need for change in the relationship. And because the reason why we aim for 8 and above is because they found that people tend to be very kind to their therapists. So, there can be about a 70% difference there. So that's how we can try and tell if we're on track with people. And normally too, like for myself personally, I'll go through that with people, but then I'll also say, what can I do different next time as your therapist to give them a sense of, as I say to people, I work for you. I may be the expert, but you're the one getting the product. So what is it that I could change to make this better?
Wow, that sounds wonderful.
Yeah, well,
so different from the way it was, I think, in the 70s. Even the most brilliant counselors did not consult with their patients much. So
yeah.
I think the profession's come a long way.
And I do need to emphasize as well that that still for people, and we haven't said this on the podcast before, that psychotherapy, coming in for therapy, it can cause harm. And it's really important for people, the therapists especially, need to recognize that they're digging into the most difficult things of people's lives. But so an individual that is experiencing something in which they're worsening, you do not need to get worse before you get better. That's actually not true. Research doesn't show that to be true. You may find some slight worsening at the beginning, but if there's consistently not improvement or a worsening, then that shows that there's something not happening correct in the therapy. And so either being open with the therapist, or I'm deciding I'm going to look for and find someone else.
Yeah. And two, it's also about asking yourself right now, like, do you have the stability in your life to be going through therapy and to be digging into these things? Do you have friends, family, consistent food, a roof over your head, money? Because here's the thing, at the end of the day, we don't want people to be going into further debt to pay for their therapist, because, even if it's $3 or maybe more than that, that's going to add further pressure that will hamper your ability to get better.
In fact, that's one of the reasons why in our office we have master's level practicum students, because we supervise them and they can provide a low fee service.
Well, if you think things are bad with Dr. Whitman, so the other nadir in my decade of my 20s came when I saw a therapist once again, but in between those two, after I left Atlanta, left the symphony, when I came home for Christmas, I was raped by my husband, one of my colleagues in the orchestra. And I don't need to go into that, but obviously it was very traumatic. And as I typically did, I just sort of channeled my turmoil into practicing harder and focusing more on my studies. But eventually, when I was in a doctoral program in Madison, I was dating a very charismatic conductor who was smart and funny and just really an appealing person. But I was first flute in the orchestra. He was the conductor, so he was a male authority figure whose approval I really wanted. But once we started dating, it triggered the old, I'm not good enough, just as I wasn't with my older sister. He's the conductor, I'm just, anyway. So I went to the counseling center and was assigned a resident, not a psychoanalytic resident, but a resident. I'll just say he was extremely unscrupulous, but really shrewd. I don't know how we're doing for time, but I do have a session with him, which sort of shows his approach. I don't know if we have time.
Yeah, we got lots of time. Yeah, for sure.
Okay.
Lots of time.
Okay, so the boyfriend's name is Bill. The therapist is Mark. So I come into a session, obviously in a bad mood. Are you having more problems with Bill? Mark asked. Yes, we argue a lot. When we're not arguing, you're talking about him, only him. My goals don't matter anymore. Maybe what first attracted you is incompatible with what you want, Mark said gently. I'm not following you. His assertiveness makes it hard for you to voice your own needs, so you become more and more passive. I wanted to yell at Mark that he was wrong. I hated being called passive like my mother, but I recognized that the intensity of my reaction meant there was some truth in his words. A few weeks later, when I went back to the subject of Bill, Mark interrupted me. why don't we talk about what's really on your mind? He suggested, leaning forward. What do you mean? Well, let's start with this. Why do you wash your hair before each of our appointments? Mark asked. But I don't do that. What about this morning? Did you wash your hair? Yes, but that's just a coincidence, I said, annoyed. I almost asked if he ever washed his because he didn't have dirty hair. If you do that, it's okay, you know, Mark said gently. You can say anything, he added, lowering his voice to almost a whisper. So he was very seductive, and I was vulnerable because, at least on the surface, he was the opposite of the boyfriend that kept putting me down. This man came across as very gentle, very kind, but he kept steering the conversation back to me. And anyway, over the next few weeks, Mark revealed his theory. My low self-esteem and depression were caused by not being brave enough to go after what I wanted. Because of the patient-therapist bond or transference, I had become attached to Mark, simply a natural part of the process. And then he says, you can avoid talking about this, but until you admit your feelings, you'll remain stuck. At first, I was suspicious, but Mark had my undivided attention for an hour, twice a week, brainwashing me session after session. Much later, I recognized the parallel with Warren, who day by day brainwashed me into thinking I was a terrible flute. So I did not get better this time with the therapist. In fact, there's one session where he convinces me, because by this time, and it happens in the winter, I always have trouble getting through January, and that is the month I was pregnant with my rapist. I don't even want to say the word child. And anyway, I was very depressed and very low energy. And when he suggested that it would be easier if I just put my head in his lap, I did that. And immediately I was stalled, and I just sat up straight and looked straight ahead. And he said, you know, that's very good progress. I know you're pulling away now, but this is a really good sign. And I left, and then that was the second suicide attempt, which was much more serious. And the problem, one of the problems, was that he was a seducer, basically, manipulative. And the other was that I had repressed trauma about the rape and abortion. But in my mind, if I admitted those things, this person, Mark, would judge me. And it was really a terrible situation. And that one, I did walk away sooner. I put that as soon as I got out of the hospital.
Wow. Yeah. And I could see your reaction, Jer. Like I felt a physical reaction myself too. Because we have a duty as therapists, because we are in that moment, or we are in that position of power. It sounds like he just took complete advantage of that, where he's talking about your transference with him. I'm wondering about his counter transference with you. Because, like that, like, analyze thyself.
Mm-hmm. Like realistically, that sounds like beyond anything that has even to do with the fundamentals of transference, countertransference. It just sounds like a person with their absolute own agenda, and that agenda was nefarious for sure.
He did lose his license, for sexually abusing his patients. And I don't use his real name. His real name is not Mark. But then he got the license back. I would never obviously trust someone like that. So it was a long time before I tried therapy again, because twice burned, really. And he was especially detrimental. He was harmful. That was a case of active harm.
Like beyond the first person, it wasn't intentional. They just simply didn't line up properly. They didn't see or read that they were misaligned. It wasn't intentional, but this one was like absolutely grooming.
Yes, and he was very skillful at knowing how to lure me into the transference den, if you will, because he knew that I admired men who were successful, et cetera, and I wanted their approval, and that I tried to get away from becoming my mother, who was very passive towards my father, very submissive. And in our family, there was sort of a myth that my older sister was brilliant and she was like our father, and I was the younger one and I was like my mother. And he knew how to twist it. He was, as I say, very insightful in many ways. So when he said, you're getting depressed because you're not brave enough to go after what you want, then it triggered that, God, I don't want to be like my mother. I don't want to be passive. But it's very paradoxical, because what he wanted was for me to fulfill his agenda.
Mm-hmm. Yeah, absolutely. This one you said was more serious in terms of you came closer to dying in this attempt.
Yeah, I had early on asked him no, I didn't ask him. He insisted upon, this time it was the opposite, taking an antidepressant. So I started taking Elavil, I think was the name of it, and it made my mouth dry, so I couldn't practice. And I thought I'd give it a few days, so I took it for a few days. But basically, I quit, and when I told him why I quit, I said, I can't practice. He said, you have no respect for me as your therapist. You're thwarting my, you didn't use the word orders, but you're undermining my authority. And of course, he wasn't as blatant as to use those words, but basically, you're being a bad patient because you're not taking the antidepressant. And that was in the fall. So the session at the end of January was the catalyst that sent me down that horrible, into the abyss of I'm worthless, I've done a horrible thing, I'm just reprehensible. And I had an almost full bottle of the antidepressants. So I bought some scotch, and I took the scotch and the antidepressants. Then at some point, I started feeling euphoric. I don't know if that's typical with someone who does this. And I thought, I called the ER and I asked them if the amount of Elavil that my friend had taken would be enough to kill her. And they said yes, and to get her to the ER right away or call 911. And so I hung up and I left. But I decided, okay, it's about 1.5 miles to the hospital. And this was end of January. It was about minus 10 degrees out. And I thought, I'll just walk there. And if I make it, fine. And if I don't, at least my roommates won't find me and have that to deal with. And I walked to the hospital. But as soon as I got there, I went into coma, I guess it was. I was unconscious for 48 hours. And the odd part was when I came to, and of course I came to in stages. I didn't just wake up to full consciousness, but when I was awake enough to think back on what had happened, I said, where did the depression go? Because all of a sudden I was free of that. And for some reason, that close encounter with death just was sort of like a switch in a kaleidoscope, and everything looked different. And I knew that Mark was a terrible therapist and human being for that matter. And all of a sudden I felt like things kind of came into focus, and I knew that I had to break up with my boyfriend and quit therapy. And that, again, I'd have to make it on my own. But I did have music, and as I said before, that was my therapy. So it was, I wish for your listeners I could say, well, this, and this, that's what got me through it and allowed me to move on with my life. But I was just lucky that I was very passionate about music, and I just channeled my turmoil into that.
I got a couple comments. One thing I would say is your process of finding recovery through music and through the community of music. I think that that other people can take an important message away from that, and that is you need a tribe. You have to have a tribe to be healthy. Really, the opposite of mental illness is connection. That's where we create this, and whether that connection is through music, whether it's through sport, wherever that is, that gains us community, I think is essential. I also just want to comment briefly on the particular medicine, because this is fascinating. The generic name for the medicine that you're talking about is called amitriptyline, and it's still very commonly used now. It's commonly used for migraines, and it is actually still a very effective antidepressant. It just carries a lot of negative side effects: dry mouth, constipation, and people, usually it's over 100 milligrams, 100, 150, 200 milligrams, and that person will feel like a zombie. It really is a very numbing entity. So when you describe what happened, like, curiously enough, amitriptyline as a comparison point creates like a euphoric high that is actually similar to someone smoking marijuana. It doesn't usually carry an issue of anxiety provoking processes. Marijuana sometimes does, but this feeling of tingliness, this feeling of my whole body is kind of enveloped in this tingly sensation. I can only imagine if you'd taken many pills, that the fact that you came back from that is amazing.
I felt gratitude for my luck every day, almost, since then. And I want to reiterate to anyone listening that when you're really depressed, and especially if you have any thoughts of harming yourself, you must reach out to people, because I ended up having a very happy life, but I sure didn't think I was going to at that point. I couldn't see any future for me. And the future has been wonderful, not without its challenges, but really the way I wanted my life to go. But you just can't believe it when someone tells you that. So try to believe it.
No,
You owe your future self to get attention and reach out. And I have thought many times about my former self and sort of wished I could go back and say, don't do it. You'll be fine. Your life is going to turn out great. but it's not, It's a Wonderful Life. You can't do that. But I guess that went sort of backwards.
Yeah, that makes so much sense. As you described your point of recovery, it's like what I heard and what you said is that your point of recovery was actually when you woke up from that medication and you had this entirely different mindset that was like, this is where I'm going to move forward in my life from. And I'm really, one of the things I've been pondering as you're describing this is, once you got through the core struggles in your life, did you ever have a relapse point of a major depressive disorder?
Yes, I did. And I'm working on volume 2 of, of a memoir. I was very career focused, and I met my husband at the college where I teach. And we fell in love, got married. And when I was looking at my 40th birthday, we said, okay, it's now or never. So we had a child when I was 40. And right before I delivered, I developed this paralysis in my hand. And it just arose right at the end of pregnancy. So I won't go into all the story about that. But a couple of years later, when I knew it was permanent, I couldn't ever play again, that's when I got really depressed. And that time I got a good therapist.
Mhm.
So third time's
Interesting. And it does not surprise me that your loss of your ability would be a massive loss of self.
Yeah, like that. Like, correct me if I'm wrong, Ernestine, but in some ways, music was your voice, your way of like speaking from your soul, as it were. So now it's about how do you find a way to speak again and grieving the loss of that voice?
That's a really good way to put it. I felt like it was the essence of who I was. I was a musician. I was a performing flutist. And that was taken away. I am very lucky that I was not one of those women who has postpartum depression. So it was only a couple of years later, when I had seen many doctors and just been through all kinds of ridiculous therapies that didn't work, that I did become depressed. And the therapist on one of the early sessions, because I said, well, I can still teach. And he made the analogy with a building that is burned out on the inside, but that the outside looks fine, but that the essence of the building is gone. And that was such a profound analogy for me, because that was what I felt, that I looked fine on the outside, but what I used to think was me wasn't there anymore. And he was very gifted therapist.
I'm glad that eventually you had someone
Yeah.
where you were able to connect.
Oddly, he had been in medical school with Mark. And when I told him that I'd seen Mark, he was really appalled, because he said no one could stand him, and it was apparent that he was manipulating patients. But yeah, I'm very grateful. And I'm also grateful that by that time, at age 40 plus, I had enough perspective that I separated the loss of music from the birth of our son. And he kept saying, well, do you want some? But I'm fortunate that I just didn't. I was very grateful that I was able to have the child, a healthy child. And it was coincidental. I think being pregnant triggered the problem, which is called vocal dystonia. And it means that when I put my hand on a flute the middle fingers stiffen. So, you can't operate the flute very well. It's a malady that musicians often get, but it's relatively rare. But of those who get it, musicians are a pretty high percentage.
So I'm curious, Trent, as we kind of come towards the end of this, I'm very curious about your thoughts and your reflections.
Well, it's interesting, because I think I want to say, before I really appreciate you coming back on the podcast, Ernestine, and being as vulnerable and as open as you are, because I think that this will be very helpful, hopefully be very helpful for a lot of our listeners, because as a therapist, we try to recognize the power that we have, and I think that, again, too, looking back on this and seeing the fact that you went through this with those two challenging therapists and had the bravery to trust a third one speaks to your strength as an individual, and I think it also speaks to the importance in our profession and why we need to keep doing the self-reflection and really recognize that we're two human beings in a process, and that we can genuinely do harm if we're not careful.
Mm-hmm. And Ernestine, for me, the big thing that comes out of this for me was your resilience. You saved yourself 2 times. No one else saved you. You saved yourself 2 times. You came from an inner place of recognizing that the only person, that moment in time that you could count on that was going to save your life was you. And hopefully there was a level of relationship that you built with yourself that was about trust and that was about respect. And I think that a lot of what carried you through was fundamentally that you came to love yourself. That's my opinion.
That's a wonderful way to put it. I tend to think of it as forgiving myself, which is not quite fair to me, because some things that happen to you are not your fault.
Mm-hmm. Yeah, it reminds me of a quote that I think we've said many times, Trent, the whole idea that what happened to you is not your fault. It is your responsibility to heal it, because whatever we don't heal, we pass on to somebody else.
Yeah, I believe was that now Gabor Mate?
Yeah.
Yeah, we haven't mentioned him on the podcast in a while, but he's definitely floating in the background, and I think that was a important one to bring up, Jer.
Yeah. And Ernestine, I don't know if people can see, there's actually tears running down my face right now. But I'm interested in your reflection, your kind of last words to wrap up and message that you want to give people in the world.
Well, I think it's just to repeat that when you're so miserable that you can't, you have a hard time seeing the future of yourself, of your life, and just to hang in there, because there's always something that you can't predict that will happen to you. I thought my life was over when I was 29. That was the second suicide attempt. I could never have envisioned that I would be a professor, that I would, in my 60s, do martial arts, that in my 70s, I'd write a book. I mean, you just don't know. So be kind to yourself. Give yourself a chance. And if you don't feel like it's a good fit with the therapist, by all means, seek out someone else. And don't feel guilty about that. There is absolutely no guilt in quitting therapy.
Wonderful. Thank you so much for this.
Yeah.
And on that note,
I'm Trent Akers.
And I'm Jeremy.
See you next time.
Thank you for joining us today. We hope that this message has been as meaningful to you as it has been to us. If you're looking for help, you can find us on Facebook at Humanizing Mental Health.